I'm going to introduce the next speaker now, and that is Chris Bramah. I have to say that it will be a pre-recorded presentation, so unfortunately we can't use the question and answer panel for this presentation because the speaker is unfortunately not able to be here. But hopefully the video is going to still give you a very good impression of Chris's work. The title of his presentation is Modeling Injury Risk in Runners.
Hi everyone, I'm Chris Bramah and I'm really sorry I can't be there virtually with you today. So instead I have sent this recording of my presentation in. If any of you do have any questions about any of the information that I bring up in this presentation, do feel free to contact me. You can get hold of me via email or you can get hold of me on Twitter at Chris Bramah. So what I'm going to talk to you about today is a little bit about my research, which has predominantly looked at biomechanical factors involved in running related injuries, but also try and position this in the wider context and how this can change how we view modeling injury risk in runners. So before I delve into this presentation, I guess I've got to highlight the severity of running related injuries within this field. If we look at the incidence of injuries, we can see between 20 and 80% of runners are getting injured annually. So that pretty much says to me, if we go out and run, there is a high probability at some point in the next 12 months we may pick up an injury. Now, of these injuries, the vast majority are overuse in nature and have high reoccurrence rates, being anywhere between 20 and 70%. Now, running offers us a huge amount of health benefits, so it's really important for us to keep our patients that we work with and people engaging in the sport. But running injury is actually the leading reason people discontinue participation. So considering the health benefits, it's really important that we tackle this issue of running related injuries and try and drive injury rates down if people are to continue being active in their lifestyles and gain the benefits from this sport. Now that leads us to our first question, which is why do we get injured? Now, this is the ultimate question of how we need to start reframing how we view the way we model running injury etiology. Because running injuries are multifactorial. They're not influenced by a singular factor, but the interaction between multiple different factors. These can be biological factors, behavioral factors such as how much training we do, socio-cultural influences such as pressures from peers to go out and engage in running, or the need to go out and run because of the interaction we get with people, as well as psychological factors such as using running to manage our stress and anxieties and ignoring pain. There's a lot of different factors out there that can influence running injury development. So because of this multifactorial nature, I think it's really important that we have structured models that help us to frame how injury occurs. And one model that I am particularly fond of is the framework for running injury etiology that was proposed by Bertelsen in 2017. Now, I particularly like this model because I feel it summarizes the multiple different factors that are involved in this process and also highlights how they can interact with one another. Now, in particular, Bertelsen proposed that injury development is due to an imbalance between the cumulative load that's applied to the body and our ability to withstand that load, or what we refer to as the tissue-specific load capacity. How much load can a specific tissue cope with? If these factors outweigh one another, or if cumulative load becomes too high, then injury development can occur. Now, cumulative load is influenced by a variety of factors itself. It's influenced by those factors that impact upon the load per stride of a run and how often we apply that load to our body. Now, one factor influencing load per stride can be kinematics and kinetics, and this has been a particular focus of my research, is looking at what are these individual biomechanical factors that may contribute to this process. So there's a lot of people out there who like to think kinematics and kinetics don't necessarily influence running injury or aren't really important. But if we look at the literature and the modeling studies that are out there, there's a large amount of literature to support the fact that kinematics can influence the loading environment on specific tissues. So on the top left here, what you can see is some of the work from Lenhart et al. who in 2015 published a nice paper which tried to look at what factors explain patellofemoral joint loads during running. And what they found was for every 1 degree increase in peak knee flexion during the stance phase of running, there was a significant rise in patellofemoral joint stress. Similarly, below that, we can see how other authors have shown kinematic parameters to influence IT band stress or Achilles tendinopathy, for example. And if we look at specific kinematic papers or papers that have looked at biomechanics, there are a large number of prospective studies that support a link between kinematic patterns at baseline and future injury development. So this really does support the argument that the kinematics that a person has or displays when they run can influence the loading environment of specific tissues. Now, for me, what was particularly interesting when I look at some of these papers is that although a lot of different injuries have been investigated, there are similar kinematic patterns that appear to be associated with lots of different types of injuries. So that led me to my first research question, which was investigating whether or not similar patterns could represent global contributors to global running injury. Now, this paper was published in the American Journal of Sports Medicine in 2018, titled, "Is There a Pathological Running Gait?" And what we did here was we took a group of injured runners who displayed all of these, each displayed different common running injuries. So patellofemoral pain, medial tibial stress, IT band syndrome, and Achilles tendinopathy. We pooled them into a global injured group, and we looked at whether or not their kinematic patterns differed compared to injury-free controls. And what we found was that there were certain kinematic patterns associated with this global injury group. And in particular, the most significant parameter appeared to be peak contralateral pelvic drop. So on the far left, what you can see is that pelvis dropping away from that horizontal level. That is what we mean by pelvic drop. Now, I know what some people might think. You might think is, okay, well, could this pattern have just been influenced by one of the injury subgroups? Well, to address that factor, we then separated all of these injury subgroups out to look at whether or not the kinematics were the same between them groups. And actually what we found was that for peak contralateral pelvic drop, this seemed to be consistently elevated across multiple different running injuries. Now that's highlighted in the figure in the middle, particularly on the top right in that figure B, where you can see peak contralateral pelvic drop amongst the injury subgroups is significantly greater than that of the healthy groups. So it suggests kinematic patterns are associated with multiple different types of running injuries. Now, because it was a retrospective study, we cannot imply causation here, but if we look back at all of those other modeling studies, there is a clear pathomechanical model for how these patterns can influence tissue stress across multiple different sites of the lower limb. So it suggests that kinematics can increase that load per stride and may influence injury going forward. Unfortunately, it's not that simple, because even if we possess some of these kinematic patterns, we don't get injured if we don't run. I always say to people, you can run however you like. If you sat on the sofa at home, despite what your running technique is, you're not going to get injured. So looking back to Bertelson's model, these factors are just one aspect that influence load per stride. Unless we combine that with a number of strides or an exposure to a training load, that cumulative tissue stress that we experience may remain relatively low. And only if that cumulative tissue stress is to rise, may injury then occur. So although we're identifying singular factors, we've got to put it into context of the overall picture of how that interacts with load exposure. And that's what we tried to do within this next aspect of our study. We tried to look at how pelvic drop may be influenced by load exposure. To do this, we took a large number of injury-free runners, 102 to be exact, and started to separate them out based on their miles per week. And we split them into a high volume group who are running more than 40 miles per week and a low volume group who are running less than 40 miles per week. And we looked at how this peak contralateral pelvic drop differed between the two groups. And what we found here was that these aberrant kinematic patterns were less frequently observed amongst runners who are injury-free and running high training loads. So If you run a lot, you don't seem to have these aberrant kinematic patterns or contralateral pelvic drop, for example. So that really raises the question of like, how has this occurred? Is it because people have adapted their mechanics as training loads increased, or do they inherently possess these biomechanical patterns that reduce the risk of injury as training load increases? How I like to look at this and break this down, and the importance of this really, is that if your exposure to training is low, you can seemingly possess high contralateral pelvic drop and low contralateral pelvic drop and remain injury-free. Perhaps because there's no exposure to a frequency of stress application that exceeds tissue capacity. But if you want to attain high training volumes, it appears that contralateral pelvic drop either changes or must change at baseline if we are to attain these high training volumes. And it really raises the question of why we're not seeing people in this high exposure with poor biomechanical patterns or high CPD angles. My perspective on this would be that the tissue stress or tissue loads imposed by these biomechanics simply can't be sustained if we are to attain high training volumes. That we need to explore a bit further, but that's my own opinion on that matter. So what does this mean for us? Well, I guess what these results from these two studies mean is that injury causation clearly isn't as simple as just possessing a risk factor or just running too much. You know, we see a lot of elite athletes and a lot of runners who can run 100 miles a week and not get injured. And at the same time, we can see people who possess a vast number of injury risk factors, but also don't get injured. So I think it is perhaps the interaction between the factors that influence the load that we experience per stride and how frequently we're exposed to that load that could influence our injury development. But also within this, we need to consider how this interacts with tissue capacity or the specific capacity of different tissues. Now, back in my earlier paper, we found similar patterns associated with multiple different injuries. So why are multiple different injuries happening? Perhaps if the tissue capacity is low of specific structures, mechanics simply just exploit the weakest link in the chain, with tissues with that lower load tolerance becoming the first to get injured as we're exposed to a training volume. So I guess where do we go from here? And in particular, how does this impact upon how we model running injury etiology? Well, I think in the future and going forward, really we need to account for the interaction effects between these different variables within our research. We also need a lot more prospective studies to support the link between risk factors and injury development. And I think these prospective studies should focus on establishing baseline tissue-specific factors influencing load tolerance, the load application per stride, and how this interacts with the training load exposure we do. And I think if we can understand these interactions better and how they influence the training loads that we can attain, it might help us to understand why some individuals get injured as training load increases and why others don't. And as a result, we might be able to better tailor specific injury prevention programs to those individuals, understanding the loads that they can safely do, and also understanding the risk factors that we might need to address with our interventions. So thank you all very much for listening. I'm sorry I can't be there in person, but as I say, if you do have any questions, please do direct them to me via email or contact me via Twitter. Otherwise, I hope you all have a good day and hopefully catch you soon.